Hello, folks. Today's video is going to be a little bit of a departure from some of the stuff I've done previously. A few friends of mine who have viewed some of my videos were kind enough to point out something that I had included in my recent hormone replacement therapy video that really wasn't hitting the mark. What they pointed out is just after the 19-minute mark, I had a discussion where I was trying to convey the fact that the misapplication of the Women's Health Initiative was a problem that not only affected women, but everyone. And the way I said it left a couple of people with the impression that I was talking about, hormonal postmenopausal women affecting marriages, causing divorces. Really a silly thing for me to say in hindsight, especially reviewing the way that I put it out there. There are a myriad of factors that obviously lead to divorces, and blaming it on a lack of access to HRT was kind of dumb. So let me try and restate the point I was trying to get across in a way that makes a little bit more sense. And I'm going to start with a bit of a story. I want to start by talking about what's happened with testosterone replacement therapy in the United States. In the early 2010s, we started to get reports through different trials that there was potentially an increased risk of cardiovascular disease in men with low testosterone that were being replaced. As a result of this, the FDA placed a black box warning on testosterone replacement products in the US, all of them, stating that there may be an associated risk of cardiovascular disease with usage. This caused a lot of concern in the medical community and with male patients who felt very dependent on testosterone replacement to feel good. And the result was that the National Institutes of Health initiated a study the same year the black box warnings came out that was fully designed, a large multi-center study, high quality, fully designed to assess the risk of testosterone replacement versus placebo. This study wrapped in 2022. The results were published in 2023, and sure enough, the study conclusively demonstrated no increased risk of cardiovascular disease with testosterone replacement versus placebo. As a result, the black box warnings were very quickly withdrawn by the FDA. So let's compare that to what's happened with female hormone replacement. We had the Women's Health Initiative come out in 2002, showing some increased risk of blood clots, cardiovascular disease, and breast cancer with oral hormone replacement therapy. Black box warnings, again, were very quickly placed on all female hormone replacement products, including ones that were introduced well after the Women's Health Initiative and had very different delivery systems. Research since then has indicated that a lot of what we saw in the Women's Health Initiative may not be the case. However, we haven't had that one large multi-center trial where the primary endpoint was safety of female hormone replacement therapy. And that is why I think that we in the medical community, in the medical research community, and the practicing medical community have done a great disservice to the women of the United States. And I can't tell you why those two things were handled so differently by the FDA and the National Institutes of Health, but they were handled very differently. I believe that this is something that needs to be remedied and corrected. We need to get that conclusive data that says one way or the other what the risks of female hormone replacement are, and better define the actual extent of the benefits as well, so we can have that informed discussion with women. Only 4.8% of women eligible for hormone replacement are receiving it as of 2023. This number seems really, really low to me. And I think with better education of physicians, better data and better education of women, we could bring that number up by quite a bit, and not only make the women of the United States and other countries healthier, but also benefit the men who love them. That's the real message I wanted to put out there. Thanks so much for checking in on my channel, and keep coming back. I'm going to have a lot more good stuff for you. Thank you.